Hello, how are you? Dr. Rich, DHS Physical Therapy, and along with us here.
Dr. Jake with Essential Motion Spine Sport.
So today we really wanted to talk. We usually come with you, or come to you with, we do a lot of teaching, a lot of exercises, education on procedures, on different conditions, and how we treat them as from a conservative standpoint, right? From physical therapy and chiropractic standpoint.
Yep.
And today, though, that's the physical side of things. Now, the other side of things that's important, actually, just as important. I mean, we're shifting from that, that biological model to a biopsychosocial model,
Yep.
which is very important. So we want to talk about the importance of the mindset of the brain and how the brain can affect, which is very strange, but how the brain can affect the physiological or the changes in the body. For positive or negative. And what happens is when we see people, we've always felt this, we've always believed this, but we needed some research to back it up. And then there are those out there doing the research that shows that, believing negative thoughts about being, I'm broke, I'll never be able to get better, my body's all busted and broken, and these things are terrible, and don't you know how bad I have it, actually has a negative effect.
Yep.
And the positive, if you think, I'm doing things to improve myself, I'm feeling better, you do feel better. Which one? Let's start with the bad ones first.
Yeah. So let's see. This one here. This just says that most of the research done on this is within regards to back pain or spine pain.
Mm-hmm.
But this one specifically says that persistent.
Which is what we deal with most.
Daily.
And it's what we often see people thinking that they get the advanced imaging. We'll go into this. Like they get scared and they're like, I have all these things that's happening to me. But yeah, that's fine.
So this one says that persistent severe low back pain and disability is common and associated with psychological risk factors, and the ones in particular that they usually talk about are catastrophization. So that would be saying, I hurt my arm, I'm never going to be able to lift my kids again, I'm never going to be able to go back to work, things like that. Depression, being upset and overly distraught over your situation. And those are two of the big ones that play a role specifically in low back pain.
And you think about that I can't say it.
Catastrophization.
Catastrophization.
Yes.
Catastrophizing. I'm terrible at that word. That is exactly what it sounds like. Instead of understanding and realizing this is a temporary setback.
Yes.
This is not forever. This is not how my life is going to be. It's just understanding that, okay, I've been injured. This is a temporary bump in the road. I got to get through this. Now, that's the difference between people who are positive and say, I'll get through this. It's just a temporary step in the a bump in the road to, oh no, my life is over. I'll never be the same. This is going to be the worst thing ever. That's a big difference in mindset.
Another big one that is often talked about is called fear avoidance. So a perfect example of this is like someone injures their back deadlifting or squatting, and then they don't feel like they'll ever be able to return to that task, or they don't want to do it because they're scared of re-injuring their back. So we see that quite a bit, I know. And some of that could just be because you think you're going to injure it, or you might have been told that by another provider, maybe a medical doctor or another chiropractor, physical therapist, even told you not to deadlift or not to squat because it will hurt your back.
Or never lift more than 10 pounds ever again.
Well, that gets in your head, and that just tells you, oh shoot, I shouldn't do that, I'm going to hurt myself. I should avoid any movement like that, and that can actually increase your pain cycle and cause you to have more negative effects than positive effects, which is definitely something we want to avoid. So,
because there is, and that's not just us being, positive. There are studies that show the way you deal with and focus on and believe your situation to be, it has actual physical effects to the body, which is just, it's very crazy to think about, but it does actually do that, positive and negative.
Psychological factors can influence inflammatory processes, level of pain perception, level of distress, and then any behavioral responses, like we already mentioned, the fear avoidance and catastrophization.
And those just then go, they snowball on themselves, and things get worse and worse. A positive example would be there was a Harvard study where they took 84 housekeepers from different hotels. So some of these ladies didn't know each other. So they took 84 housekeepers from 4 different hotels. They split them down the middle. They told half, all right, so maybe 42 of them. They told, listen, guys, you guys are doing a great job, and the level of your work, right, is enough to, I'm going to say the exact words here so I say it right. Okay, your regular work was enough exercise to meet the requirements for a healthy, active lifestyle. So that's all they said was that you guys are active enough, moving around, cleaning rooms, that you are exercising while you're working. The other half they told nothing to. And then they sent them all back to work. A very short time later, I think it was 4 weeks later, so it wasn't very long, a month later, they went and rechecked to see, would this change their physical, bodies by just believing that they were exercising while they were working. And it did. So what they found was that on average, the women in the informed group, right, so the group that was told they were exercising, had lost on average 2 pounds. They'd lowered their blood pressure. They lowered their BMI, which is their body mass index, so they lowered their body fat percentage. They improved their hip to waist ratio. So they overall had physical changes in their bodies just by believing that what they were doing during their working time was exercising. And that's just mind-blowing. They didn't do anything different. And it was significantly different than the other group that they didn't tell anything to. So that it does work. You just got to tell yourself that, you're going to get through this, and it's a temporary bump in the road, and you're going to get, better. What else did you find on there?
Let's see here. I think I pulled one.
I had found some stuff too from the Mayo Clinic, just some of the healthy, the positive benefits of mindset training, of understanding that you don't have, and it really goes back to the difference between a fixed mindset and a growth mindset. If you're fixed mindset, you've told yourself, this is the way I am. I cannot get any better or improve on anything. I just have what I have. Like, I was born with this kind of, like, let's just say, it could be anything. It could be math. It could be your ability to read. It could be anything, but if you're telling yourself that I'm born this way, and I was never good at this, again, I'm never going to get better. This is the hand I'm dealt, and I just have to deal with it. That's a fixed mindset. That is different than a growth mindset where you're saying, right now I'm not good at this, or right now I'm hurt or I'm having trouble, but that doesn't mean that's the way it has to be forever. Like, it's just in the moment temporary, but I'm going to improve. It's a small shift, but it's a huge outcome in the results. So the benefits of thinking positively, having that mindset shift or change to a growth mindset would be increased lifespan. In fact, they even had ones that in a nursing home, I remember a study where residents were allowed to just have a choice of how they position their room. Like, I want my bed over here. And they gave them a live plant. Like, they got to choose a plant. Those people lived longer. It increased their lifespan. I mean, by years, a significant amount, because they just had the ability to then positively feel like they had control and power over their lives, rather than just being told what to do all the time. So another thing, it increases lifespan, lowers your rates of depression, decreases the levels of distress, or again, that'd be a negative stress. Better cardiovascular and not only physical but psychological, health. That all plays together, and we're just starting to find out, I think, the level of interaction and connection with the brain to the body. Did you find another one?
This one just kind of reiterates what we're saying, that psychological processes, so how we think about something, can actually affect neuroanatomy and physiological processes within the body. So that's how we can see it play a role in our pain, blood pressure, whatever the other things you described just a few minutes ago. Mm-hmm. So it's just really interesting that how powerful the mind really is. And one of my favorite quotes that I've heard is mind over matter. So no matter what the situation is, you're thinking can positively or negatively affect it, and you have control over that.
Yeah. And I think that's the start of it. Once you realize, just understanding that I do have control over the way I'm perceiving this setback, or this injury, or whatever's going on. It's how you perceive it, but you have the ability to change how you perceive it, and then that perception will then change, the outcome. But yes, it is. I think taking a step back and just understanding that you have the choice and understanding that part is the first step.
Yep.
Once I realize that, my mind's not fixed. I can change the way I'm thinking about the situation. And you can even your perception of the situation. You could say, well, this is the worst thing ever, and my life is now over, or, well, this is this is bad. It's definitely something that I need to work on, but could be worse.
Yeah. Something's always got worse.
Yeah. I mean, it's
that.
just even that little mindset shift of understanding that it's not as bad as you possibly could be is the start. We just wanted to talk about that mindset stuff. We see that not all the time, but often enough where often enough where we can tell by talking with someone an initial assessment phase. How many discs that they have, balls. Yeah. Don't you know that big file? Here's all what's wrong with me. Here's what's wrong with me. Okay. Well, if you believe that's what's wrong with you, then you're going to have that problem.
That becomes their identity. That's what they talk about.
Yeah.
And it just goes into a cycle.
Just like the catastrophization, they actually latch on and start to identify with the name of the pathology. Yeah, like their condition rather than being.
I am a rotator cuff. You can't fix this because it may not be true, but they heard that.
Or may not even be what is causing pain, but a picture shows what it is. So they know I am. This is bad. So then again, it snowballs. I can't do stuff because I believe I'm injured. So then I won't go have any fun. I won't go out and exercise.
So
I won't go out and play with my kids. Yeah. Because then I feel even worse. And then relationships suffer. Interpersonal relationships with your family and your friends, and then your own your own relationship with yourself. Again, it's just you have to shift that image, and it's a 180 shift, and it doesn't happen, instantaneously. But
No.
I think the first step is just recognizing that you have it. Recognizing that you have the negative thoughts and mindset, and even that just recognition of what's going on. Then you can slowly make slowly make improvements out of that. I'm trying to think of some other ones here. Let's see. Positive psychology is a scientific study of a healthy interest. Okay, this might be
One thing that I read that was interesting a while ago was that one of the biggest predictors of low back pain is job dissatisfaction. So if you don't like your job, that can be one of the biggest indicators that you might have low back pain, which is crazy.
How important is that? So it has nothing. I mean, if you can correlate how happy someone is, how satisfied they are with their life, with their job, with their if they're highly satisfied, they don't get hurt. Yeah, I mean, now they still could, but it's significantly less when you're saying that it's correlated directly to more lost work, more lost revenue, higher incidence of pain, higher incidence of lost work due to back pain. It's just
crazy.
That stuff is not something that we make up. It's just it's out there, and you probably even kind of innately know that. Like it makes sense, right? Like I'm not happy. I don't feel good. So that's the basics of it. So we'll post this up, and please subscribe, like, share the videos out, tag someone, anybody that comments.
Yep.
We want to grow this channel. This one is dedicated to helping those with herniated disc, bulge disc, protrusions, back pain, neck pain, anything having to do with the spine and those type of issues, things that people have been told that they have, and they're very common. We're going to give as much information as possible to help you recover from those and now change your mindset, because you can have all those things and still feel fine.
Right.
So it's all on how you perceive that stuff. So, okay.
All right, guys.
That's the main thing.
There you go. Take care. Holler at us.